Showcase what the FETP graduates who also be graduates, what they have said and what the faculties who have said. So let's watch the video.
Hello everyone, my name is Dr. Mame Amwade. I serve as the resident advisor for the Liberia Field Epidemiology Training Program, Liberia FETP, and I work for AFINET, the African Field Epidemiology Network. I must say that with every graduation, we have this sense of excitement and fulfillment, but the graduation of this cohort is something that brings so much joy that we have never experienced. Perhaps not just because it is the first executive cohort that we are graduating, but also because of the anticipated impact that we have for this group as they go out to practice what they have learned from the training. Yes.
Yes.
Exactly. When you say insert, go to insert, there should be insert somewhere. Insert.
I'm Dr. Woody, Chief Medical Officer for the Jackson Edward Hospital, interpreter and County. I'm happy and excited as a member of the first cohort of the Liberia FETP program. In time past, this function has been exclusively designated to the surveillance officer, and I have not actually delved into her activity, and I don't know what exactly she's been up to. But now, with the information provided with the education that I have gained, I will not be able to go and form part of, to go and supervise her activity, to go and ensure that wheresoever the problems are, we can work together to make sure to have a good coverage of surveillance interpreter.
I want to be grateful to the Ministry of Health, NPHIL, the US CDC, and AFINET for the opportunity given me. As supervisors, we are to have public health knowledge in order to help us to have to make informed decisions as public health managers. I want to say it was a wonderful experience. It was insightful.
My name is Godwin Akpan, Geoinformation Specialist and IT Specialist with AFINET Liberia. It was a joy to have medical directors come for our training at the FETP, Executive FETP, and I pray that the experience they have gained here will transcend into their daily routine and at their various health facilities, and that improve our activities as field epidemiologists in this country. Thank you very much.
I'm Dr. Billigan M. Sanyo Koha, Deputy Medical Director for LFEFP Hospital, and this time with the FETP training, it was a great experience and great knowledge gain. Like I have more knowledge on public health surveillance, and this knowledge on public health surveillance will help me to improve the surveillance system in our health facility.
My name is Dr. Sibley. I'm the Medical Director of FETP Hospital. I'm so grateful for this training. It really afforded us the opportunity to learn what exactly surveillance is and what the importance of it in our health system.
I'm Himiere Debbie Sise, the coordinator of the Executive Field Epidemiology Training Program, only Liberia Field Epidemiology Training Program. So The Executive FETP program has actually been a worthwhile experience, taking into consideration our cohort members who are clinicians with little or no public health background, bringing them into the classroom and teaching them about our surveillance system, how it operates. It has been a worthwhile experience.
I'm Dr. Willamette Williams Gibson, Medical Director at Redemption Hospital. So opportunity to be part of the first cohort of Executive Epidemiology training. I had an awesome time learning more about surveillance and IDSR in our country. And it's my expectation to learn more about IDSR so that I can not only contribute to the work at Redemption, but to Liberia as a whole. Thank you so much for the opportunity after this.
My name is Dr. Edwin Smore, the Medical Director for the Liberian Government Hospital in Bombing County. This training has been an eye-opener for me, and I do appreciate every bit of the process as we went through. Today, I can assure you that as I leave, my eyes are opening to surveillance, and I will continue to do whatever I have been taught to apply in our facility and teach others as I have been taught. Thank you so much.
Yeah, I'm Dr. Babalola Obafemi, Dr. Babs for short. I'm one of the facilitators for the FETP Executive, and it has been a very good class so far. The course is fantastic, and we could see their motivation, their ability to quickly assimilate all what we are trying to let them understand. And they have rolled out several activities and actions for them to implement. Some of them have budgetary allocations, and they are looking for partners who will also help them to do all this, all in the process of improving the resilience of the health system in Liberia.
It makes me very happy to understand that you all as medical directors and doctors will be able to reframe your thinking so that when you see people coming into the hospital, yes, they will have one issue that you need to treat for that one person. But you will be able to say, this person has this characteristic. It reminds me of how this issue is going to be impacting the entire community. And you'll hopefully be able to think about it from a much more rich, I think, perspective. So I thank you.
I'm Lily Sambi Blebo, a field epidemiologist with Affinet, Liberia FETP, one of the facilitators for the Executive FETP program. So my experience with the Executive FETP has been a very different one compared to the other tiers of the training. I personally am very happy to have experienced this training, to know that there's still more we can do, there's still more impact Liberia FETP can make to the health system in Liberia. And I hope we continue and that a lot of people can benefit from this experience.
Hello, I am Dr. Daniel W. Kofa Jr. I'm the Medical Director of CJ Comprehensive Health Center, Grand Cayman County. I want to thank the Ministry of Health, the National Public Health Institute of Liberia, the Center for Disease Control and Prevention, USA, the Affinet for the opportunity afforded in basic training in epidemiology and surveillance.
I am Dr. Siawata Kamano, Chief Medical Officer of the John F. Kennedy Medical Center. My FETP executive experience, it was fantastic. The trainers were knowledgeable, they were approachable, they were friendly. The content was excellent. We learned basics in epidemiology, public health surveillance. It was also practical. We applied skills in Microsoft Word, Excel, and PowerPoint presentations. It was eye-opening. I, who once was blind, and now can see. There's been light thrown over the darkness about surveillance. And we are now armed and dangerous as disease detectives.
I'm Dr. Robert MCU Jr., medical doctor assigned at the Kanta United Methodist Hospital in Compass City, Lima County, Liberia. This training, the Executive Field Epidemiology Training Program, is like a dream come true.
Thank you so much for all the time. I remember calling weddings late at night, early I send email, WhatsApp to Dr. Peace more than 100 times that you have to make his farmer input. And thank you all so much. I'm sure each and every member here did the same with them with us. We are more than grateful for this level of knowledge gain. Godwin can never be forgotten. In the past, some of us, for me, I didn't have any, what should I say, interest in epidemiology. But from this cohort, I think I've gained 100% interest. So I'll be glad to enroll in the intermediate or even go further for studying epidemiology if God's willing. Thank you so much for all the support.
So over the past 6 weeks, we have had the privilege of training 14 dynamic, energetic medical directors from various health facilities across the country in the basics of surveillance, reporting, data analysis, data visualization, data display, and most importantly, the use of data in taking quality decisions towards improving the health of the people within their care. We expect that as this group is going back with the skills and competencies they have built, there will be an improvement in the implementation of IDSR at their various health facilities, and we expect it also to even spill over into the communities within their jurisdiction as well. So on behalf of the AFINET family, let me say a warm congratulations to all of you. Every one of you has done excellently, and we know you are going to make us even more proud as you go out to actually practice what you have been taught. I want to say thank you to all involved in this training up to this point. Thank you CDC for the funding and technical support. Thank you MPhil for hosting us and providing all the training facilities that we enjoyed. Thank you Ministry of Health for catching the vision with us and running along with us. And thank you everyone who has been part of this. And we say kudos to those who are graduating. We wish you all the best. Congratulations.